can't see. A very good evening to all the participants for today's webinar. But before I begin, let me wish all of you Happy Women's Day. And what could be a better topic on a Women's Day than to talk about the health of women? And in order to brief all the ladies across the globe how they should take care of their health, we have a resource person, Dr. Mohini Vachhani, a specialist in women's problem and has done her MD, DGO, DFP from Mumbai and MRCOG, FRCOG, DFFP from UK. She did practice for 7 years in Mumbai and was attached to Hinduja Healthcare in Mumbai, Hinduja Healthcare Surgical Car and SL Reja Hospital, Mahim. She was attached to Bandra Baba Municipal Hospital, where she established colposcopy. Ma'am, correct me if I'm wrong. We do not know the technical words like what you call it as. Colposcopy Center for Management of Precancerous Condition of Cervical Cancer. Apart from practicing as general obstetric and gynecology, she is a founder of In Sync Gynae Care in Khar, Mumbai, where she looked after her obstetric and gynac patients. She is practicing as consultant gynecologist and obstetrician in UK since last 27 years. While in UK, she had conducted various hands-on workshops in various parts of India, Mumbai, Goa, Pune, Nagpur, teaching general gynecologists the art of management of precancerous condition of cervical cancer. She has taken part in various women's welfare camps in Mumbai. She has given lectures at local, regional, and international level. Today, she will talk about hygiene. Today, she will talk about also hygiene during menstruation. And girls can freely ask her questions during the question answer round. So here we welcome our doctor, joining both the hands, Dr. Mohini Vachhani, a very well-known, I repeat, a very well-known gynecologist from UK who has been practicing for the last 27 years to brief all the ladies who have joined, all the women, and also if there are men who have joined, can pass on the information to the ladies at home. So today is a day where we give special importance. The importance need to be given 24/7 to ladies. Ma'am, you will agree, doctor, you will agree, across the globe, women only take care of their children and spouse. Their priority is only their children, their spouse, at the cost of neglecting their own health. When it comes to their health, they postpone it. But when it comes to their children and their spouse, they may leave every other task, but give their time, devote their time for their healthy food, for their health. But here I feel that all the women across the globe should also know why it is so important for you to even maintain your health. How do you balance both your professional and your personal life? Because these days all women are also working in order to maintain the standard of living for their family. So it is an art to balance both your professional and personal life and to maintain your health. So without wasting much time, I pass on to doctor today to brief all of us about women's health and the art of balancing it. Thank you, ma'am. I welcome you on behalf of our management, ABVM Agrawal Jatia Kush, on behalf of all our managing committee members, and also on behalf of me, Dr. Rajeshwari Ravi, who is the director and the principal of Ghanshyam Das Jalan College. Over to you, ma'am. Thank you.
Thank you very much, Dr. Rajeshwari, for your kind words. And I must say, before starting, I also want to say Happy International Women's Day. And we know as women, we are doing always a multitasking. And as you rightly say, we look after our spouse, our family, and we neglect our own health. And that is where we want to know that if we want to do a lot in the life, we have to see that first is like a oxygen first to yourself. So you have to see that you have to look after your own health. And saying that, we know a woman, today we are going to talk about hygiene during menstruation. Yes, I must say, to start with, I must thank first Dr. Rajeshwari, Ravi, as well as Mrs. Trupti Matlani, who is my patient since a long time, really. And you have given me an opportunity on this International Women's Day to give my own experience as well as pass on my skills, as well as bring an awareness among the girls, among the women about the women's health. Now, we know that as a woman, the woman gets the period at the age of around 11, 12 years, and they have the period till the age of 50, 55. So you have around 40 years of your age, which is every month, which is multiplied by 12. So all these months, you are having the periods. Now, if you did not do the proper hygiene, there are a lot of consequences. So today we are going to talk about the hygiene during the menstruation. Can we have the PPT, please, the PowerPoint presentation? Okay. Now, we are talking about hygiene during the menstruation. Can you have the next one, please? Now, menstruation is a natural body process. Now, talk on the menstruation was a taboo in India over many years, and people never used to talk about the menstruation. To that level, even the girl was segregated in one part of the house or in the villages out of the main living area around the periphery of the house. The woman was asked to take a bath whenever she got her period, let it be in the middle of the night. And I do remember very well my Masi, that was many years before, even at around 1 o'clock or 2 o'clock, you are in one or two bedroom house and you're supposed to take a shower, because my nanny used to say, no, you have to take a bath whenever you get the period. So if nobody knew it, by this act, everybody knew it that this girl has got a period. I mean, that is really contrary to what we want to do it really. She was not allowed to sit on the same bed. This used to happen, I remember, when I was a child and adolescent and I had the period. My auntie, she used to come and she would say, oh, I don't like people who are sitting on the same bed. I won't allow anything. Then I used to tell my mother how she will come to know whether the girl has got a period or not. I mean, she is talking about that, no, I will do a lot of chua-chu to not allowed to sit on the same bed. They were not allowed to go to the school. They were not even allowed to cook, not allowed to enter in the kitchen, not allowed to do prayer or to enter in the prayer area. They were using a reusable cloth as a pad and to wash and dry away from the prying eyes, and of course, not in the sun. So that was not healthy, also. This was a thing which I was surprised to know or to read it when they say they used to use an ash from the sigri, which is a stove which you use it in the villages for cooking when the coal wood or dry cow dung was used. I mean, this was a shocking to me when I read about this really, and I heard it in somebody's lecture. So this was years before. So at that time, the things have changed now, of course. I mean, by this way, if you are using an ash, you are introducing infection. But those things were not even talked about it in the olden age. Can we have the next slide, please? Now, issue around the management during the menstruation, or we call it as a period, is much less in urban India, which you know. Now today we are talking about hygiene during menstruation. And actually, I must say that now it has become a digital India. I will be even talking about or taking a part in this sexual and reproductive health Mela, which is going to be happening on 25th, 26th, and 27th of March, where the children or the adolescent girls from the Hindi-speaking belt of the states or the villages, they will be coming on online. They will be asking the questions. They will be given awareness about different aspects of your health, really. So I feel it, yes, things are changing a lot, but still the problems still persist in rural part of India, albeit a much less degree, really. And thanks to our high-tech things, which is now the digital India, really. Next, please. Now we are going to talk about what is actually a menstruation. Now, the menstrual blood, which is the one which consists of the blood which comes from the uterine cavity. That is a uterine cavity. You will see that is in the picture, which is in the center as a triangular thing, which is along with the lining of which is shed from the uterus. Then the blood flows from the mouth of the uterus, that is the cervix, and then it will collect in the vagina. Now, blood in the uterine cavity, when it is there, yes, then it is completely sterile like a venous blood. But once it reaches the vagina, it gets mixed up with the bacteria and the cells which are lining the vagina. And every woman, they have their unique smell of the blood for that particular individual whenever there is a menstruation. So a woman knows what is the particular smell of the blood. Now, if there is anything changes, then the woman should get worried or should get concerned about it. Next, please. Now, different modules which you use for the menstruation. You use it like pads. You can have a disposable or reusable, which nowadays people are using it. And of course, in the olden days also, they were using the reusable from the cloth. But nowadays also, it is going back to having using the reusable from the cotton. And this is happening not only in India and abroad also, in UK, USA, people are using even the reusable pads, which is becoming very healthier one, because disposable, you could have it one which is the one which is from the cotton one, but has to be a soft cotton one. So more people are going towards the reusable, and that is also cost effective. Second is the tampon. Tampon is the one which you put it in the vagina during the period time. Then you have a menstrual cup, which is also being used in India as well as abroad here, where you have the cup which you put it inside the vagina and during the period time, so the blood gets collected, and then slowly you have to, it is made of a silicone, so which is very smooth and malleable. So then you remove it and you can use it, menstrual cup, for about 12 hours. And then you have a menstrual disc, which is much more softish, and that is the one which is used similar like a menstrual cup, really. So it is a pads, tampon, menstrual cup, or a menstrual disc, different modules which you are using during the period. Next, please. Now, we want to know, when you're talking about the hygiene during the menstruation, how come or from where you get the infection? You could get an infection, descending infection, which is if there is any infection in the blood, which is supplying the uterine cavity. That means general infection. This could be a bacteremia, which is a bacteria in the blood, which occurs in severe systemic infection, or infection in the pelvic organs like uterus, tubes, ovaries, which is in the genital tuberculosis. Then is the second is either it is from down or it is coming from above. So it is an ascending infection, which is an infection which is traveling from the vagina through the cervix to uterine cavity, then the fallopian tube to the pelvis, and then spread to the ovaries and the rest of the abdominal cavity. This is exactly here we talk about hygiene during the menstruation. Next, please. Now, what could be the types of infection? You could have a bacterial or you could have a viral infection. The bacterial, which are different names like bacterial vaginosis, fungal infection, which is a yeast infection. Then you have what is sexually transmitted diseases or sexually transmitted infection, which is a chlamydia, gonorrhea, syphilis, type of it. You can have an HIV, other things. Now, viral infection is the HPV, which is a human papillomavirus infection, which can give rise in genital warts or any precancerous changes and cancerous changes of the neck of the womb, which ends up or results in cervical cancer. So there are two different types of infection, and we have to see that during the hygiene, during the menstruation, we have to see that one person doesn't get any infection. Next, please. Now, what can happen if there is an infection? Now, how do we know that I have contracted the infection? There could be a very strong smell of the blood. This happens because if there's an infection, the bacteria give rise a different smell, and that is a strong smell of the blood. Then there could be an irritation down below. There could be an itching on the vulva. It could be a rashes or swelling of the vulva, and can end up with having a boil or ends up with abscess with a pus leaking. You could also have a discharge after the menstruation finishes. Then you know that there is an infection which lurks and it shows in between the period. Also, the woman can have a genital warts. I'm sure you are aware about it, or otherwise I'll say it's more like a skin tag, which will be around the vulva, around the anal area. And it is a very, very painful condition. And it's an STI, which is a sexually transmitted infection. It is caused by human papillomavirus. Now, other thing is pelvic inflammatory disease, which is called a PID. When the infection spreads from the vagina, it will go up and it will go into it will affect the uterus, fallopian tubes, ovaries, and into the abdominal cavity. And not only does that infection, it starts, if it is severe and is untreated, that can cause and adhesions to the abdominal viscera. That means the intestine can get matted together really. Now, late effect of pelvic inflammatory disease, what happens is that the tubes will get blocked. And once the tube gets blocked, it will cause infertility. So you have to see what are the long-term effects of the infection. Now, HPV infection, which can cause precancerous changes and then cancerous changes of the cervix, ending up with the cancer of the cervix. There's one other syndrome, which is a toxic shock syndrome. This happens in the patients when you use the tampon, and that is keep it there. Ideally, you should change it frequently, but if you leave it more than 12 hours and then the blood gets absorbed, and that causes very acute fatal systemic infection when using tampon for a prolonged period. And this can end up with having a high fever, flu-like symptoms, having a pain, diarrhea, and that can affect slowly the other organs of the body, ends up with having a respiratory failure, and the other organ failure ends up with death as well. So we have to be careful with whenever using a tampon. I would rather say that when you're using a tampon, it will be much better that first few days, when the days when it is a heavy flow, you can use the tampon. The rest of the days you can use the pad. So it is between the mix and match really, rather than only using a tampon. And if you use a tampon in the night, then at once when in the morning, try to remove it rather than leaving it for the whole day. So that is a toxic shock syndrome. Next, please. Now, how hygiene during the menstruation, which we are talking about, is, of course, we have to shower daily. Try and avoid not showering daily. Use clean, fresh underwear or a panty every day. Use clean cotton pads. Wash the hands before and after disposal of the pads or a tampon. Whenever anybody is using a menstrual cup, clean the menstrual cup with soap and water, because this is a reusable. Dry completely with fresh, clean tissues, and then you can use it. The same is with the menstrual disc. Also, whenever you use it, you must safely dispose the pads or tampon. Don't just throw it away. It is cover it properly, either in the tissues or in a separate bag, and throw it away, because that can again give rise the problem with, especially in India, having insects and having cockroaches and other, with the infection. So keep it safely, dispose of the pads and a tampon. Also, the other is change the pad or a tampon at least every 4 hours. It can be more frequently if you have the flow is quite heavy. Why? Because blood is a good nutrient for bacteria. You avoid the development of toxic shock syndrome. So try to see that you frequently change the pad and a tampon. Other is avoid sex during period, or if some people, they do the sex during the period, I would say use a condom during the period, so that you do not want it that there should be an infection, because with the having sex without using a condom, the infection can spread from a male partner to a female partner, and blood is a very good nutrient at that time. Next, please. Now, general hygiene, use cotton underwear, cotton panties. I know people would like to have a nylon and with other type of the panties, but especially when you are having any problem with with itching or with other thing, I always say it's better to use the cotton underwear and panties. If you're using the nylon or other, use it for a very short period rather than for a longer period. Then use loose undergarments at night, only pajamas at night, because especially in India, where there is a lot of humidity, and if you use the cotton, if you use the tight undergarment, that can give rise a fungal infection. It is a very good fungal infection. Just imagine if you have a bread, and if you keep the bread little wet and keep it outside, that can give rise to fungal infection, because it is a worm. So if you keep it, if you leave the areas to have an aeration properly at night, that is a better. So use the loose undergarment and pajamas at night. Drink around 2 to 3 liters of water daily. This is to prevent the dehydration and urinary tract infection. If you drink more of water, which is cause a proper hydration in the body. I know nowadays there are lots of vaginal washes and the douche. I would suggest avoid the use of scented vaginal wash and a douche, because the one which causes the vaginal wash, that changes the pH of the vagina, and that is the one which is going to give rise in infection, really. So I would say avoid using scented vaginal wash or a douche. Use a plain, simple, warm water or a clean water, that area, because we do not want even the healthy bacteria which are there to help prevent the infection pathogens to come, to get it destroyed. So use a plain water, or at times a very, very light soap and water, but I would say just a plain water will do. Now, after opening the bowel or having a poo, wash the area with water and then wipe clean from front to back, never from back to front. The reason being that there are bacteria from the intestine like E. coli, which are, although okay for the bowel, but when they reach to the vagina or near the urethra, they can cause vaginal and urinary tract infection. And this is what I found it when I was working or when I was practicing in India, that many people are not aware about it. Like this is a simple thing that you, after having a poo, how to clean it. Yes, they will clean it, dry it, but again, they will start having a lot of them with an infection. They come with white discharge, with itching and irritation. And then I used to tell them about washing the area, and people, they started using the scented vaginal wash and the douches, and that is the one which is trying to change the normal flora of the vagina. Next, please. Now, this is, we talked about the health normal hygiene during the period. Now, today we are going to talk about much more than the menstruation. Now, this is the regular exercise. The woman, the exercise should not be only to a man or other people. You should do the regular exercises. Healthy diet, very important. Avoid multiple partners. Use condom if the relation is new. Avoid multiple partners because you are not aware about. I know that things have changed in India as well. Mainly this having a multiple partner was mainly the talk of Western countries. But now the things have come back to India. I know in abroad, a girl, once she becomes around 2022, it is written or it is statistically mentioned that they have had 33 partners. So I don't know whether in India it has come to that level, but I do understand when I was practicing that people do have the multiple partners. So I would say whenever you have the multiple partners, you try and avoid, first of all, try and avoid the multiple partners, but use the condoms with every new partner, with partners, because we don't know their sexual history. You know about yours, but about the other partner. And if it is a relation is new, I would say use a condom. Now, use of contraceptive pill along with a condom is to avoid the unwanted pregnancy and contracting sexually transmitted disease. So it is not only when you're using a condom, you will say, forget about not using contraception, or when you're using contraception, then you say, I won't use a condom. No, I would suggest use both of them so that you can have the double effect of having an unwanted pregnancy and contracting sexually transmitted disease. And of course, then you can have the different other problems, which is even HPV giving rise to cancer as well. Next, please. Now we'll talk about, there are some myths. Now, some people, they say that coitus interruptus or withdrawal of penis before the ejaculation is a safe method of contraception. No, I would not agree on that, because sperm, which is a fluid before the ejaculation, may contain the sperms and can result in pregnancy. I was actually involved in doing an online consultation through Practo when I was in India. And many people would, many couple, they would ask that we have done the withdrawal of, coitus interruptus and we have missed the period. Are there any chances that you can become pregnant? Of course, you can become pregnant, because there is a possibility, because sperm can contain the sperm. Now, also the questions were asked, sex at the end of the period is safe? No, I would not say that. Now, sperms, they live in the uterus for 5 days and the time of ovulation is not fixed. So pregnancy could still result. These are all the myths which I have got it when I was doing an online consultation. Now, pregnancy is only possible if a man and woman are intimate. Now, I would say pregnancy is only possible if the pen is coming in direct contact with vagina at the time of ejaculation. Now, this is a practical question was asked if the girl with the panty on, the guy had ejaculation. So I would say that there are so many myths. So we have to understand and we have to know the reality, what is the reality. And that is why I thought it, I will just put these myths because I have come across the girls asking me so many questions. So I thought it'll be a good idea. Next, please. Now, we want to say that when a girl becomes sexually active, 2 to 3 years following that, you should get the screening done for cervical cancer by pap smear, and then regularly every 3 years, and more frequently if you have multiple sex partner. I remember there are some patients who will come and they will say, no, I have had a pap smear around 5-6 years before and I was all okay, it was negative, and she doesn't want to get it done again. No, you have to get it done regularly every 3 years. And as we say, very, very important. And she will say that I was sexually active once and then I'm now no more active. But I would say, yes, once it was done, then you could have an HPV infection, which is dormant and it can get active. So it is better to get it every 3 years. Once in a month, after finishing the menstruation, you should do the self breast examination for presence of lumps in the breast as a screening for breast cancer. Very, very important. I know that girls will say we do not know how to get examined and when in the menstruation, in the month, when to do it. It is always after you finish the period, because before the periods are have started, you do get small lumps in the breast, and that could be because of the secretory phase of the period. So it is always recommended or always being told that after the periods finish, you do the self breast examination. To start with, it's much better to get it, to learn it from a doctor and then do it regularly, and which I used to teach my patients whenever they came in my clinic, really. So do the proper breast examination. You can go online, check it about the self breast examination, and once in a month after the period, you must get it, do the self breast examination. All the more better, all the more important for the woman when in their family, either the mother or the auntie or any of their first degree relatives, they have suffered from breast cancer. We know the breast cancer is very common. It is 1 in 8 of the women where they have the breast cancer. So it is better to take the responsibility to yourself and do the examination. Then taking an HPV vaccine. HPV vaccine is for cervical cancer. So it is starting from the age of 12 years till a woman is at the age of 45. The best time is before girls become sexually active, but a married woman with children can also take vaccine. Now, this HPV vaccine, they have started giving in the schools, at least in UK. In India, when I was there, we used to have the vaccine camps, and I started giving the vaccine to the college girls, and we were giving it. This was a national college and Metipai College. They were, because I was in car. So the Bandra, the colleges, they came and I had given the vaccine to them. Now, it is not on, the best time is when before the girl becomes sexually active. But if she has become already sexually active, she's already married, still she can have a vaccine. And as we say, until the age of 45, she can still have it. The cervical cancer can occur later also. So we do not know. It is better to have a vaccine and get it out of it. Next, please. Now, general advice, which I want to say, these are the simple thing. In India, we do that. If you are doing and having an arranged marriage or marriage, then the people, they see the Janam Patri, they check it whether, your Mangal and your Saturday or whatever, they are matching, whether how much the girl and a boy are, the boy is going to take or something like that. But I would say, yes, you do by all means. But apart from that, always get the following properly. Get the woman's blood group and RH. If the girl's blood group is RH negative, always, if it is not a love marriage, of course, if it is an arranged marriage, try to see if the boy's blood group and RH, what is it? If it is positive, then there are implications on the children. So if the girl is negative and the boy is positive, then there is a problem during the pregnancy, as well as it will affect on the children. Some of the children, if nothing is being done, the woman, they can have a miscarriages, you can have the intrauterine deaths because of the RH negative and RH positive. Then is a hemoglobinopathy, which is a thalassemia state. If the thalassemia is trait is positive, just the woman is carrier, then you check the boy's thalassemia state. If the boy's thalassemia state is also positive, then there are implications on children, because if both are positive and they both are trait positive, then 1 in 4 child can suffer from thalassemia major, which is a fatal disease really. So you have to check it on that it should be a positive and positive. Then check the serum rubella antibodies. If the serum rubella antibody is negative, it is better to get the vaccination, because a woman, girl, if she gets pregnant and then she has, she's negative, and if she gets the rubella infection during pregnancy, the baby can become blind. So it is always better for the woman to get the vaccination on serum rubella. Normally, children or the babies, they do get MMR vaccine when they are around, I think, 15 to 18 months. That is the measles, mumps, and rubella. And ideally, they should be positive. But at times, it may happen that the baby or the child doesn't develop the antibodies. So if it is a negative, then get the vaccination. Or sometimes the children, they haven't had the MMR vaccine. So it's better to check the rubella vaccine. Now, other thing is, if a girl suffers from PCOS, which is a polycystic ovary syndrome, do not delay the pregnancy if you want to have a family, because polycystic ovary, they may require an assistant. 1 in 3 girls in India, they suffer from polycystic ovary syndrome. Polycystic ovary syndrome is not a disease. It is just one part that this is there. And there are people who are, there are many people, many women, when they are polycystic ovary syndrome, they do have the children, there are no problem, but they do have the problems like having an extra hair on the face. They have problem with having a periods, which are very scanty period, and they do put on a lot of weight. So we have to check it on the polycystic ovary syndrome. Then other thing is that if a woman is trying to become pregnant, it is better to take folic acid as a supplement 3 months before trying for a baby, because the folic acid deficiency can have a neural tube defect in the baby, which is like having a meningioma, or all around along the neural side there could be a defect. So as an anomaly, congenital anomaly, so it's better to start taking a folic acid. Next, please. And I must say thank you very much Next, please. Any questions? I'm ready for that.
Good evening, ma'am. There's a
Hello.
question in the chat box,
Okay.
and I would like to ask you on behalf of Ms. Sapa Sheikh, what is the difference between PCOD and PCOS?
PCOD is polycystic ovary disease, and it's a polycystic ovary syndrome. Both are actually the same, but people have started putting as a disease. It's not a disease, it is just a syndrome. And there are people, the meaning of a syndrome is that if you have all those symptoms which I told you, that having an extra hair on the face, being obesity, having a scanty period, having a problem with having babies, then everybody doesn't get all the symptoms. You can have few of them, and some it can be few to others. And disease means you are putting them as having a disease which can be treated and cured. No, polycystic ovary syndrome is a syndrome. Only few of them will be there. And once it is there, it is there. It runs into the families. We have to be careful with that, really. Yeah. Now, I've already answered, you cannot cure it, but you have to treat with whatever problem has happened, really. So I would say it will be a much better if we can have a real one session on polycystic ovary syndrome. So that will be a full chapter. So what can be done really, and not to worry, because 1 in 3 women who's suffering from polycystic ovary, that's quite a lot of patients really in India. It is only 5 to 8% in abroad, but it is more in India really.
Ma'am, there's one more question
Yeah.
from our staff itself, and it
Yeah.
is how to prevent breast cancer.
Yes, prevention of the breast cancer is, you cannot actually prevent, but you have to see that you have to get it screened, and you are breast cancer goes into the families. So once it is there, it is in the families, you have to be vigilant with your screening. The other thing is, if you don't have not fed the baby, the chances of breast cancer are much higher. So you cannot prevent. Prevent will be having a good, healthy life with exercise, with diet, screening. That is why I would say. Now, what kind of a diet should be maintained in order to correct PCOS or PCOD? I would say try to use PCOS word rather than PCOD. All the diet which is white in color, like avoid having a sugar, which is a white, maida, that is white. Anything with having a white thing or having a high glycemic index, that can give rise, that can upset the polycystic ovary. Also, the patients with polycystic ovary, they are at a higher risk of developing a diabetes mellitus. So you have to check it that the diet, along with exercise, try to maintain your weight. That is very, very important with polycystic ovary. Can you explain more about the Rh negative and Rh positive combination? Yes, I can say. Now, if a woman is Rh negative, okay, all the problem arise there. If she is Rh positive, not to worry, because that is mainly people, they have it. Now, if you have an Rh negative woman and the husband is a Rh positive, then the chances are it goes like few of the babies will be, the children will be Rh negative, few will be Rh positive, but there will be the one which will have the problem, which will be Rh negative. What happens is that if it is an Rh negative and an Rh positive, and the mother is carrying an Rh positive baby from the conception, then that Rh positive is an antigen. which will try to cross the mother's blood and have the antibodies. The first baby, nothing will happen. But when she develops, when she has a second baby, and nothing has been done in the first pregnancy, normally with such patient, if the woman is Rh negative, we always give injection anti-D at around 28 and 34 weeks of her pregnancy, so that if there was any chance of developing an antigen, that will not be crossing. So important is to give an anti-D to the mother. Now, if it was not given, which used to happen long time before, then this baby, this first baby, nothing will happen, but then the mother is sensitized with the antibodies. So next time when there is an Rh positive baby, that blood will go into the baby's blood, and then that can cause, that will destroy the baby's RBC. It will end up with anemia and having a hydrops fetalis, and then as it will happen, if it become a severe one, then the baby can die. Do you want to ask, did you understand anything or not?
I hope that they have understood. Ma'am, I have a question.
Yeah.
The white discharge after the periods or menstruation, is that healthy?
Now, any white discharge which is not smelly, which is not itchy, which doesn't give rise any rashes, I wouldn't worry on that. But any discharge which causes itching and it's smelly, yes, I would go get tested, check the swab result and check it whether there's any infection.
So is there any color or texture that it should have, or it is just like a watery substance?
It is a watery substance. Now, every woman, they know their own discharge, right?
Correct.
Now, if the woman's panty stains the yellow, that is fair enough, but it keeps on having its smelly discharge, then I would get worried. Other thing is, if you have a curdy discharge, which is like a curd as though thrown on the panty, that is more likely as an fungal infection. So that has to be checked. The smell, it could be a rotten fish. That could be a bacterial vaginosis. So there are different things. Anything which you feel it's an itching, but if it is a whitish discharge, more discharge. Now, you could have a more discharge if a woman is getting excited. Suppose you are reading a romantic novel or something, you do get a discharge. That is a normal, so not to worry about it. But if there is a smell coming, any itching, or as you say, causes any irritation, yes, I would go.
Ma'am, one more question I have.
Yeah.
It is about the menstrual cup. Actually, I have heard that, I have not seen anything or I have not researched about it, but I have heard that menstrual cup is only used by married women and not by unmarried girls.
No, the thing is you have a different sizes about the menstrual cup. You can have a one which is for virginal and you could have a one which is for after the marriage. So it will all depend, and it has to be made not from the plastic, it should be a more of a silicone. And there is a technique how to put, this is the same thing, like to start with, as a young, as a unmarried or not, I wouldn't say unmarried, I would say not sexually active woman, they were not using tampon because they thought it would be difficult to insert, but you have a smaller size tampon which you can use it. And so there are different, like abroad, we have the, for virginal, for other, I don't know what in India, but I just went and checked it and they said, yes, it is available in India as well and people are using.
Yeah.
But I don't know, like, I'm not there in India for a long time, so I don't know whether people are using, but yes, it is available and virgins can use it.
Okay. Ma'am, there's a question from Lakshmi Pillai. She's asking about after menopause, how frequently should we get ourselves checked for cervical or uterus or other cancers?
Now, you don't have to wait for the menopause, first of all. The menopause can occur at different ages. As I told you, as soon as a person is sexually active, you start getting the screening for cervical cancer. Now, the cervical cancer screening can go on till the age of around 64 years of age, every 3 years, which is a must. Now, for the uterine cancer, you should try to see that if a person is having an heavy periods, then you have to get an ultrasound done to check it what is the lining of the uterus. If the lining of the uterus is quite thick enough, we have to check it. And this is especially when around 45, 50 years of age, or the woman they are using any hormone replacement treatment. So they are the one you check it for that. So because of course we know that the cancer can develop at a later age. Now for the breast cancer, I would say even the age of 30, I would start telling the girls to start doing the self-breast examination. I mean, especially if anybody in the family suffers from breast cancer. So I know my own sister, she had a breast cancer, and I would get it all me, my sisters, my daughter, my niece. I've told them that they should start getting examined. They should do it. And rather, actually, when I was in India, I had what is called a breast light. Of course, I'm right now abroad, but breast light, where you can check it by examining the breast, whether there are any problem. Because I know there are so many people, they say, no, we should go for a mammography. No, don't go for a mammography that frequently, because mammography is eventually that you are exposing yourself to radiation. And if you expose yourself to radiation, that is not right. I mean, every 1 to 2 years, if you do the radiation, that is rather going to put you into the condition like the chances of having a leukemia are higher if you are exposed to radiation. So I would say no, do the self-breast examination. And if you possibly get a breast light, nothing like it. But otherwise, after the age of 45, 50, then you can have a mammography.
Okay. Ma'am, there's a question. It is asked by Ms. Riddhi Mishra, and she's asking, what happens when the PCOD lasts for 3 to 4 years? Is there any risk about it?
The PCOD is going to last, or PCOS is going to last forever. So there is nothing like 3 or 5 years. Anybody having a polycystic ovary, what is PCOS? Is in the ovary, you have the small cyst. Like every follicle doesn't ovulate, so they stay there. Now, if it is in polycystic ovary, there are, as I told you, there are people having a lot of hair around, with on the mustache, on here, and they have babies without any problems. There are people very little of the hair, but they are obese. They have a problem with having a period problem, and they are having, if they want to try for a baby, is difficulty. So I would say, in case if you're a PCOS, it is not a death sentence. So don't worry about it if it's a PCOS. Yes, PCOS can happen. It's more common in Sindhis, Punjabis, and that belt really, rather than, I would say, no, this is more common over there. So it's 1 in 3. Other people can have it 1 in 5, 1 in 8 really. So once a PCOS, it's not going to change. So you have to be careful with your diet. The diet is because you are at a higher risk of developing diabetes, and you're at a higher risk of developing even uterine cancer with polycystic ovary syndrome.
Okay. Okay, ma'am. There's another question. It asks that which one is the best to use during periods? Is it menstrual cup or pads?
Again, it will depend on if you're quite okay with a menstrual cup and if you are okay with a pad. But pad is definitely you're not inserting anything. You're not, if you're okay with putting a finger inside the vagina, putting the things, and you have no problem, I think people can get on with it with the menstrual cup. But if not, then of course the pads are always there. And that is why I would say pads nowadays, try to use a cotton pads. I know there are lots of fancy pads in the market, but they are the one which can give a lot of irritation also. I'm not for any particular brand. It is the cotton one. They are the one which are good. Look for the cotton one. There are people who say there are scented one and this and that. I would say avoid any scented material for down below. People use a soap. No, this is the one which is very nicely scented and all. You could get an allergic reaction to that. It's better to use a simple warm water, try to clean it, that is will be okay. And the pads, I would say yes. Try to look for, I don't know whether in India they've started using disposable, reusable pads. I don't know. But abroad they are really, even they have got a YouTube on how to make yourself the pads really. So which
Yeah.
is going back to the previous,
Not
like,
on full-fledged, but somewhere it has been started. Like,
yeah.
yeah, it has been started to use the reusable pads.
Hmm.
Okay, so the next question, ma'am, here is what is thalassemia status and causes?
Now, there are no causes as such. It is you are being born with that really. So thalassemia, it is the as an anemia really, which develops because normally in our body you have an and a beta and hemoglobin. But if you have a different chains, different protein molecule in the blood, in the heme part of your hemoglobin, that can give rise, that can put you as a thalassemia minor and thalassemia major. Now, if a woman or if a baby is a thalassemia major, I wouldn't say woman, the thalassemia major, they become anemic so quickly that in 6 months, you may require every now and then the blood transfusion. That's a thalassemia major. But thalassemia minor is the one that you do carry that protein, but in the heme, but you, because you have the other protein, you don't suffer the anemia, but your hemoglobin can never go beyond 10 or 11. You do carry the thalassemia minor. Now, if a girl is thalassemia minor and she marries a thalassemia minor boy, then the chances of their baby, 1 out of the 4, if they were supposed to have 4 babies, then 1 will be thalassemia major. So I have had so, and you can never say that if a person is, I had so many patients who the girl was minor and we got the boy and boy was positive. So then we don't know whether the baby who's carrying is thalassemia major or not really, because it is better for such people that in case if you want the full complete like definite 100% to check it, they can go for an IVF to check it, that you see what is the blood group and then do it. But I would say it is much better because 1 in 4, the 3 babies will be normal, but you have to be careful on that really.
Uh, okay, thank you so much, ma'am. And there's a last question here. So someone is asking, I get my periods too late after 10 days of my menstruation cycle. So what can be the reason? And extending to this, I would also like to ask a question. What is the minimum or maximum days that a period should stay?
There is nothing hard and fast rule at all. It will all depend on how wide or what is the area of your uterus, okay? Because what is menstruation, as I told you, it is the blood along with the lining which is coming shed really. So there is no hard and fast rule how many days it should last. There's no hard and fast rule that how frequently, what is your monthly cycle. It will be fixed for that particular individual. Now, if you had the regular cycle, which is 28 days, I know people, they say 28 days, but for particular person, if you are having a period every 35 days, that is normal for you. So not to worry about it. So it is a fix for one particular person. If it is, if you have a regularly 35 days and then after about few months or whatever, if you get the period of, you don't get a period by 50 days or 55, yes, I will get worried on that. But otherwise, there's no fixed rule for how many days it should last or how frequently it should come. It is a fix for that particular person, really.
I think we have done with the questions, Kamakshi.
Yes, ma'am. Yes, ma'am. All questions are done. Thank you so much, ma'am.
Great. Dr. Mohini, we would like to extend our thanks. After, of course, Vamakshi will give it. Before that, I need to share what I felt like today. After such a thorough orientation for the young girls and ladies on menstruation, sometimes I feel if only when I was young, we too had a doctor like you who would have oriented us, probably would have taken much more care. But today's session was really good for all the women across, young to, for any age, that you have already cautioned them what are the do's and don'ts and how they should be checking. I'm sure with your tips and your advice, they will definitely merge more healthier day by day and will take all the precautions. Thank you so much, Dr. Mohini. But at the same time, one more request from our side, from our college. As you said, for PCOS and PCOD, you can give us a...
I knew it was coming. It was coming.
You can give us a completely one-day session. So at your convenience, whenever you're free, you please let us know. We would like to schedule an entire day session that is for 1 hour from your side on PCOS and PCOD, because I find there are many who are suffering silently with the fear. But I want these people to, like you motivated, you said there is nothing wrong about it. It's not a death sentence, they can very well go ahead with it. That's the kind of encouraging words I look forward for these youngsters who are really afraid with PCOD and PCOS.
I agree.
So whenever, doctor, you're free, please do let us know. We would like to schedule a session with you again.
I will definitely. That is the very reason somebody asked me. There's a youth people, they are having a sexual and reproductive health mela on 25th, 26th, 27th of March. And they asked me, will you, and that is also again my patient, and said, Dr. Vachhani, do you mind really? So I said, that is fine. And that is for the Hindi belt people. So, the adolescent girl and those who are scared to ask any questions. Simple things, really, as I told you, the myths, really, which I was surprised that these myths can happen, like you're fully dressed and this can the pregnancy happen. So I was surprised that but there are things which they want to ask, really. So I'm happy, guys. I told them, yes, I'm happy on all 3 days. I will do it, because it is much better that you should make them aware so that they don't have the wrong impression and they don't fall into a wrong problems, really. So I would suggest, I'll be happy. I'll tell Trupti about it whenever.
Yeah, sure. Thank you, Dr. Vachhani. And every word, every statement that you uttered was very, very motivating and inspiring. And look forward for more sessions from your side. Now I pass it on to our youngest faculty, Professor Vamakshi, who was asking the question, to extend the vote of thanks.
Thank you very much. Yeah.
After asking so many questions, I have to give you the vote of thanks, ma'am, for your very informative session. So a lovely and warm good evening to the respected resource person, our director and in charge principal, Dr. Rajeshwari Ravi, all my dear teachers and all my dear friends who are present over here. But before delivering the vote of thanks, I would like to wish all the sturdy and selfless ladies here a very happy International Women's Day. It gives me an immense pleasure to deliver the vote of thanks for today's webinar. I, Assistant Professor Miss Vamakshi Verma, on behalf of Ghanshyamdas Jalan College of Science, Commerce and Arts, would like to propose a vote of thanks to our respected speaker, Dr. Mohini Vachhani. Ma'am, as you said initially that yes, menstruation is a taboo, and yes, it is a taboo because every girl, every lady face that part of their life, uh, holding that thing, they have to face that scene where some or the other person points out that you don't have to use the word menstruation, or you don't have to use the word period in front of many people, or in front of men especially. But yes, as you have given us many ideas, we have learned many things from you. It was really an informative session, and you gave us many ideas of having a healthy menstruation. I would like to show my gratitude to our management committee and our director and in charge principal, Dr. Rajeshwari Ravi, for taking the initiative of hosting and organizing this very informative international webinar. I thank all the participants for attending this webinar. Thank you so much, guys. Now I request all the participants to please rise up for our national anthem.
जन गण मन अधिनायक जय
हे भारत भाग्य विधाता,
हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा, विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे, तव शुभ आशीष मांगे, गाहे तव जय गाथा। जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे। जन गण मन अधिनायक।
Thank you so much. Thank you, ma'am, again for this wonderful webinar. And thank you everyone for attending this webinar. All the participants, I would like to mention this, or you have already seen it in the chat box, but still I would like to mention it that the feedback link for today's webinar has been posted in the chat box. Only after filling the form, an e-certificate of participation will be provided to you. So please fill that form. And once again, I'm really overwhelmed, ma'am, with this session. Thank you so much, ma'am.
Dr. Vachhani, I would like to thank you for your time. Time is something which, nobody gives that way. But even on this important day, you have given us that valuable time, and it was so informative. God bless you. Thank you so much.
Thank you.
Thank you.
I must appreciate that you have started the initiative. Important is somebody has to start. Yes, people will be there, but you have thought about it, and that I would say it is a real good thing for all the students really. And I'll be happy to give it on a PCOS, no problem at all. Really.
Sure, ma'am. Even that we will take it as international only, because for your information, there are many who have logged in from countries like Middle East, Canada, US, from UK. There are many who are all logged in. So even Australia, people have logged in. So that would be very, very informative. Thank you so much once again on behalf of GT Jalan.
Thank you.
Thank you.
Thank you much. Thank you very much.
Thank you, ma'am.
Thank you.